Okay, I'm just gonna start off by looking at the provider's orders here. So we have Shirley Cost, date of birth is 5/14/90. She has an allergy to penicillin. So it looks like she has fluids running right now, 0.9% normal saline, 1,000 milliliters of 20 milliequivalents potassium chloride IV. And then we have orders for PRN, morphine sulfate, IV push. She can get 4 milligrams every 2 hours for pain. And then we'll be giving vancomycin 1 gram by the IV piggyback. Gonna look over her labs right away. Everything looks good. I'm gonna go in there and talk to Shirley. So knock, knock, knock.
Hello.
Hi Shirley, my name's Madeline. I'm gonna be your nurse today. Can you verify your name and date of birth?
Shirley Cost, 87.
Okay, sounds good. Checking your band. I saw you have an allergy to penicillin, is that correct?
Yes.
Okay, sounds good. So how are you feeling right away? Are you having any pain?
My incision site's a 9.
Hurting pretty bad?
Yeah.
9. Okay. On your leg at your incision site, you said?
Yeah.
Okay, sounds good. Could you describe the pain? Is it like a shooting pain?
It's stabbing.
Stabbing, okay. Well, I saw that we have some medication that I can get for you, since you're hurting pretty bad, and then I also have an antibiotic that's due for you. Is that okay if I go get that for you?
Yeah.
Okay, sounds good. Just gonna get vitals, do my assessment. This isn't running for the video, but just so it's not beeping the whole time, but we're gonna pretend that the IV fluids are infusing the whole time. Okay, Shirley, I'm gonna go get everything ready and I'll be back in just a few minutes, okay?
Sounds good to me. Thank you.
Okay, you're welcome. Hand hygiene, I'm gonna come back out here. So looking at the orders, so we're gonna get her morphine sulfate and the vancomycin, so I'm gonna grab those right away. Vancomycin, got the morphine. I'm gonna grab my other supplies that I need. Secondary tubing, some alcohol wipes, syringe, needle, and my flush. So that's all ready. So I'm just gonna do my first med check with my morphine. So we have the morphine sulfate. It's not expired, doesn't need to be diluted. Already checked. These medications don't have any interactions with her fluids or potassium. Clarity's good. I don't see any particles in there, so that looks good. Gonna do my first check for my vancomycin. So we have the 200 milliliter bag of vancomycin. We're gonna be giving 1 gram, so that looks good. There's no holes, it's not expired. Clarity looks good. Okay, grab some gloves so I don't forget. And I'm gonna do my second med check right away. So I have the morphine sulfate. The order says 4 milligrams and the label on here says 10 milligrams per 10 mils. So we're gonna be giving 4 milliliters of morphine. Again, checking the expiration date, that looks good. I just said it's not expired. There's no holes, no clarity looks good. Okay, so I'm gonna draw that up. So first, I'm gonna grab my alcohol wipe. I'm gonna clean this off, 10 seconds. Make sure that's all clean. Okay, that's gonna go in the garbage. Take the cap off here. I'm gonna attach it to the needle right away. Okay, and I already verified we're giving 4 milliliters. So I'm gonna drop 4 milliliters of air. We're gonna inject that into here. Injecting the air, we're gonna get the morphine drawn up. Make sure that there are no air bubbles in it. Okay, so looks good. And I'm gonna have the second nurse come in and we're going to verify the dose. And we're just gonna make sure that we waste the rest of the morphine according to policy. So I'm gonna recap this so it doesn't get contaminated. And I'm gonna label my morphine. I'm gonna put that as 4 milliliters of morphine. So it's ready to go. My second check is done. This is gonna go in sharps. So I'm gonna do my second check of my vancomycin. So comparing it to the MAR, we have vancomycin 1 gram IV route daily. So we have 1 gram per 200 mils here. It's not expired. It's for Shirley. The clarity looks good. It doesn't need to be activated, so it's ready to go. So I'm gonna go back in and talk to Shirley. Knock, knock, knock.
Hello.
Anti-Gene. Hi Shirley, it's Madeline, your nurse. I'm back. Can you just verify your name and date of birth again for me?
Shirley Cost, 87.
Okay, so I'm just checking your band. We went over your allergy of penicillin. I'm just gonna bring your bed up, okay? So I have your pain medication ready. Still having pretty bad pain?
I am, yeah.
Okay, so I'll give that to you first, and then I'll give you your antibiotic. Just gonna bring this up. Be tall. So right away, since I'm at the bedside, I'm just gonna do my 3rd check of morphine right away. So I have my morphine, I'm comparing it to the MAR. I have 4 milliliters here. We're giving it IV push every 2 hours, PRN for pain. So my 3rd check is good. Anti-Gene. Put my gloves on. And I'm just gonna inspect the IV site right away. So I'm just taking a look right away. I don't see any infiltration. Open this up. I'm gonna clean this. 10 to 15 seconds. Okay, so that's clean. I'm gonna flush it, make sure it's patent, everything looks good. So flush 3 to 5 mils. Okay, are you having any pain, Shirley?
Nope.
Okay, sounds good. So that flushed, don't see any infiltration or irritation. So now I have my morphine. So we have 4 milliliters here, and I'm gonna be giving it at a rate of 1 mil per minute. So I'm gonna push this over 4 minutes. Have the clock here and my watch, gonna keep an eye on it. Push it really slowly. Okay, so it's been 4 minutes. All right, Shirley, so that should start to work pretty soon, kind of relieve your pain. Now I'm going to scrub it again, and then we're gonna flush so we can get the remaining medication through there. Let's scrub for 10 to 15 seconds. That's done. And since there's still fluid in there, still medication in there, we're gonna flush at a slow rate again. So I'm gonna push 1 to 3 mils of normal saline. We're gonna flush over 1 to 3 minutes. Okay, so that's good. After all this, I'm still looking at the IV site for any irritation, anything like that. Okay. All right, Shirley. Like I said, you should start to feel better. We're all done with your pain medication. I have your antibiotic now that I'll get ready, okay?
All right, that sounds good.
Okay, so I'm gonna do my 3rd check right away. So we have the vancomycin, comparing it to the MAR. We have 1 gram per 200 mils, IV piggyback. It's not expired, it's for the correct patient. No holes or anything, clarity looks good. So that looks good. I'm gonna go ahead and get my tubing ready. Maybe. Okay. So I'm gonna take this out. I'm gonna go ahead and get my fluids shorter than the piggyback med is gonna be. Put this there, so that's ready to go. Okay. So now I'm gonna prime my tubing. Okay, rid of that. Make sure this is clamped. Okay, so I'll take this off. Make sure that I'm not contaminating anything. I'm gonna spike it. that's in there good. We're gonna fill the drip chamber up about halfway. And again, I don't need to activate this one. Okay, hang that up. Then I'm gonna prime it. So I'm gonna take this off. Careful not to contaminate the end of this. I'm gonna prime it. Let a little bit of fluid come out. Okay. Get a little air bubble out here. Okay, so it looks good. It's all primed. There's no air bubbles in there. I'm gonna put this back on. Put this here, and I'm gonna grab my labeling so I can label the IV tubing so we know when to change it. So I'm gonna put the date and the time in my initials, label the tubing. So that's good to go. And then, since the IV fluids are running right now, we don't need to flush this guy right here. Oh, what am I looking for here? I'm gonna scrub it for 10 to 15 seconds before I attach it. Garbage. Scrub this for 10 to 15 seconds. Okay. Make sure I don't contaminate any of that. Okay, so now that's attached. So now fluids would be running normally, but now I'm going to get this all ready. So I'm going to turn this on. These off. It's powering up here. Unclamp this. So new patient, yes. On the med-surg unit. Confirming that. So to get the fluids started, we're going to go to guardrail IV fluids. We're going to 0.9% normal saline with potassium chloride, 20 ml equivalents, yes. Giving that at a rate of 125 mils an hour. Volume to be infused, 950 so we don't run the bag dry. Start. I'll pause that right away and get my secondary medication. So we're going to go down and click vancomycin. We're going to, again, I'm just verifying, 1,000 milligrams per 200 mils. That looks good because this is 1 gram. Click that, yes. And we're giving that at a rate of 133 mils an hour. I'm going to start that. Okay, so that's running. Everything's good to go. Vancomycin's dripping. Gonna pause this. For the sake of the video, I'm coming back at a different time, but surely your vancomycin is done. The infusion's all done, so I'm gonna take care of this and disconnect it, okay? So I'm just gonna turn this off. The fluids are still gonna be running, but just so it doesn't beep for the video. So the fluids are still running. I'm gonna get rid of this. I'm going to dispose of this per the policy. I'll disconnect this. So getting rid of this. Put some gloves on. I'm going to scrub this. I'm just going to flush it to make sure that everything's good. Flush that. I'm going to flush the whole thing here. Okay, so I flushed all that. Again, I'm checking the IV site. How's the IV feel? Is your hand hurting at all?
Nope.
Okay, sounds good. So we're all done. I'm just going to go document everything, Shirley. I'm going to document the fluids and the medications that I administered. I'll come back to check on your pain every now and then. Do you need anything else right now?
No.
Okay, sounds good. I'm gonna lower your bed. Okay, so the bed's low. I'm gonna go do all my documentation, and I'll come check on you in a bit, Shirley, okay?
All right, sounds good. Thank you.
You're welcome.